but you should know his life journey. It is such an inspiration in itself. You will be proud that he is the one who is leading us, who was the leadership of our association. So, a brief video about his introduction, and then how to choose a thesis topic is something which you will learn anyway from him. But there are a lot of life lessons to be learned from the immediate video which follows. Sir, stage is all yours.
Every exceptional accomplishment begins with one single step of hope, courage, and commitment. This is the story of one such person who has made India proud in the field of medical science on a global innovator, a research scholar, and a compassionate human being. Born into a middle class family in the year 1956, he was a diligent student right from childhood, one who loved and valued education. Dr. Sajja hails from a small village, Chandrapet, Chirala Mandal in Andhra Pradesh. He did his basic medical education, MBBS from Guntur Medical College and MS from Jipmer, Pondicherry. Later, he went on to do his super specialization, MCH, in cardiothoracic and vascular surgery at the All India Institute of Medical Sciences, New Delhi, the premier institute of medical education in India. He obtained advanced training under the world-renowned cardiothoracic surgeon Professor Denton A. Cooley at the Texas Heart Institute, Houston, Texas, in United States of America. Professor Cooley was the pioneer in cardiovascular surgery who performed over 120,000 open heart surgeries across the globe. At a very young age, Dr. Sajja was conferred with the Fellowship of American College of Surgeons, Chicago, USA, in thoracic surgery in the year 1997. With over 3 decades of expertise and clinical excellence, Dr. Sajja has performed over 21,000 open heart procedures, predominantly over 16,000 coronary artery bypass grafting (CABG) surgeries. Dr. Sajja's journey into the field of cardiac surgery began with a pivotal moment at the ASI annual conference at Guntur Medical College in 1978, where he attended a talk by Dr. K. M. Cherian. It was there that his interest in coronary artery bypass surgery was kindled. As a final year MBBS student, he had the opportunity to visit the cardiac operation theatre at Southern Railway Headquarters Hospital in Perambur, Chennai. This led him to write an article entitled Recent Developments in Surgery of Coronary Atherosclerotic Heart Disease, which was published in Guntur Medical College magazine during final year MBBS. Dr. Sajja is the first Indian surgeon to present original research at the 86th annual meeting of the American Association for Thoracic Surgery at Philadelphia, USA in the year 2006 on coronary artery bypass grafting with or without cardiopulmonary bypass in patients with preoperative non-dialysis dependent renal insufficiency, a randomized study. This became a clinical citation. In 2014, he became the fourth cardiothoracic surgeon practicing in India to gain active membership of the American Association for Thoracic Surgery. Driven by his innovative spirit, Dr. Sajja pioneered the development of a mechanical prosthetic heart valve, an achievement that eliminates the need for long-term oral anticoagulation. This innovation has been recognized with awarded patents in both the United States and India, and awaiting animal studies. Additionally, he designed the mammary artery support platform to facilitate the usage of beta in coronary artery bypass grafting surgery, which was nominated for IACTS Innovation Award in 2012. Dr. Sajja leads multi-center randomized trials in India. His Promote Patency trial achieved global acclaim as India's first multi-center randomized controlled trial in cardiac surgery, which was presented at IACTS in the year 2018. Currently, he spearheaded the PREDICT surgery with support from the Indian Council of Medical Research, New Delhi, actively engaging in international multi-center trials such as Arterial Revascularization Trial and the Roma trial. Dr. Sajja's contribution extends globally, playing a vital role in advancing the field of cardiac surgery on an international scale. Dr. Sajja was the only Indian faculty contributed to the consensus statement on cardiovascular surgery associated acute kidney injury in 2017 at the 20th International Consensus Conference of the ADQI, which stands for Acute Disease Quality Initiative in Croatia. His prolific scholarly output includes authorship of over 110 articles, accumulating over 3,050 citations with an H index of 23 and an I-10 index of 41 across diverse peer-reviewed journals. In addition to serving as a guest reviewer for prominent journals, Dr. Sajja holds editorial positions in respected publications. He proposed a classification for coronary artery anomaly dual LAD. His research findings have been cited in over 50 textbooks on cardiothoracic surgery and allied specialties globally, underscoring the widespread recognition of his research. Dr. Sajja is the 24th recipient of the Dr. Yelavarthi Nayadumma Science and Technology Foundation Award for the year 2022 and the first cardiac surgeon who received the coveted award for his contribution to cardiac surgery. Dr. Sajja is nominated for the Academic Global Surgeon Award from the American College of Surgeons, Pfizer, for the year 2024.
This video is just to inspire you because when the cardiothoracic surgery is looking at the crossroads, whether it's a branch that is going to perish. So I just collated how I could achieve this. I'm sure I'm no better than the one of the least interested person in the house, because I was like from rural background. If you have an interest how one can achieve and plan, and for that the research and publication has been the main motto for this study. I would be now talking to you how to choose a thesis topic and writing a paper. Choosing a thesis topic for cardiothoracic surgery resident involves careful consideration of relevant research areas within the field of cardiothoracic surgery. We discuss some key factors and sessions to help you guide the selection of thesis topic. Focus the clinical relevance. It is one of the important things when you decide a thesis topic. There should be a clinical relevance. Focus on topics that have direct clinical relevance and can contribute to the advancements in patient care and outcomes. Explore areas such as new surgical techniques, novel treatment approaches, and improvement in patient management. We also should consider the current trends and innovations. Stay informed about the latest trends, technologies, and innovations in cardiothoracic surgery. This could include advancements in minimally invasive procedures, robotic surgery, or new medical devices. We have to identify the gaps in the research, identify gaps in existing research literature. Look for areas where there is a limited knowledge or conflicting evidence, providing an opportunity to contribute to valuable insights. It's also important to have collaboration with the other specialties while choosing a thesis topic. Consider interdisciplinary collaborations with professionals from related fields such as cardiology, radiology, or even genetics. This can lead to a more comprehensive and holistic approach to your research. We have to concentrate on the patient outcomes and the improvement in quality of life. Investigate the topics that aim to improve the outcomes and enhance the quality of life for the individuals undergoing cardiothoracic procedures. This could involve studies on postoperative recovery, rehabilitation strategies, or even long-term follow-up. We have to also consider the technological advances, so explore the integration of emerging technologies in cardiothoracic surgery and assess their impact on the patient care. We also should include consider the epidemiological studies, because any selecting the thesis, probably if you consider conducting epidemiological studies to analyze the prevalence and the risk factors of specific thoracic conditions, this can provide valuable insights for the prevention strategies as well as early intervention. We also should keep in mind while selecting a thesis topic, if possible, the global health perspective. Investigate cardiothoracic health issues from a global perspective. This might involve studying the prevalence of certain conditions in different populations or evaluating the effectiveness of cardiothoracic interventions in diverse healthcare settings. Ethical consideration is very important in conducting any thesis topic, selecting it. Addressing ethical considerations in cardiothoracic surgery, such as informed consent, end of life care, or resource allocation. Exploring these issues can contribute to a more ethically informed and patient centered practice. Seek guidance from mentors. Explore the resources available within the institution. Collaborate with experienced researchers and utilize available facilities to enhance the research process. After choosing the topic, we should also master the craft to excel in scientific paper writing. So all the thesis should be converted to a paper at the end of the conduct of the study. Clinical research in India in the field of cardiothoracic surgery is modest, hence resulting in very limited number of publications, although a large volume of cardiac surgery procedures are taking place in India. A large portion of Indian research often goes unnoticed in the international arena due to lack of publications in the visible, popular, and high impact journals. We need to focus on outcome analysis and publications in our practice to make our experience known to the world. Presently in India, approximately 1,60,000 CABG procedures are performed, and it is only next to the United States where they perform close to 2 lakh operations, highlighting the widespread reliance on this surgical technique for coronary artery disease management. India's prominence in the realm of CABG surgery extends further, with around 55% of these procedures performed on beating heart. In India, we perform the largest number of beating heart CABGs in the world. And also we use multi-arterial grafting technique. About 17% of the patients received 2 or more arterial grafts in the CABG procedures in India. Whereas in the United States, it's only 6% of the patients receive multi-arterial grafting. So in India, we practice much more evidence-based medicine than in other countries. But while the number of cardiac surgical procedures performed in India is very high, the corresponding number of publications by Indian surgeons is very low. In the we look at the Annals of Thoracic Surgery, the journal, which is one of the top journals in cardiothoracic specialty. If you look at, we have gone through the published data from the journals, that we could find only 2 original articles are published by Indian authors in the last 3 years. So that looks, the volume of surgery we do is so much, and we are just publishing only 2 original articles from India in the last 3 years. It's a very minimal publication. Similarly, if you look at the Journal of Thoracic and Cardiovascular Surgery, that is the flagship journal of our specialty, there was not even a single original article authored solely by Indian authors in the last 3 years. Although A few surgeons have co-authored who participated in the international trials. Publications on the was published in JTCVS. Similarly, the European Journal, which is also a high impact journal with an impact factor of 4.3, and we have published only 8 original articles in the last 3 years. And there is an encouraging trend that now in India we are also publishing a lot of papers. In Asian Annals, this is one of the leading journal in this area of the world. We have published in the last 3 years 28 original articles, but it is still very low in the thing. Our Indian Journal of Thoracic and Cardiovascular Surgery, which has PubMed indexed recently, and also impact factor, inaugural impact factor was 0.7. And this credit goes to Dr. O.P. Yadava, who is working tirelessly to publish more and more original articles that are from India, that made our journal more visible on the international scenario. And we have published about, in a 1 decade, about 120 to 130 articles, and in the last 3 years about 35 original articles were published in our journal. So if you look at the work we do in India is on par with almost equal to that of United States, but the number of publications and the knowledge generated on Indian soil is much less. It is less than 10% what the United people from United States or Europe is producing. So what is research? It is defined as studious inquiry or examination aimed at the discovery and interpretation of facts, revision of accepted theories or laws in the light of new facts, or practical application of such new or revised theories or laws. What is publication? It is the dissemination of your findings or our findings to the scientific community, and scientific publications are subject to peer review. Why one should write a manuscript or publish a paper? To advance professionally, to qualify for grants, for the particularly to conduct studies, and to contribute to the growth of your institution, to contribute to your field, and to improve your own practice and personal satisfaction. The excuses we found, people who do not publish, they say that lack of time, needs a lot of efforts, unfamiliarity with the process, and bad experience if their articles or manuscripts are rejected early in the career or attracted severe criticism. Why to publish? Publishing is one of the necessary steps embedded in the scientific research process. A paper is an organized description of hypotheses, data, and conclusions intended to instruct the reader. If your research doesn't generate papers, it might just as well not have been done. What to publish? New and original results and methods. Reviews or summaries of particular subject. The manuscript that advance the knowledge and understanding in certain scientific field. What we should not publish is material of no scientific interest, outdated work, the duplication of previously published work, or incorrect or unacceptable conclusions. What is not acceptable for publication? Papers that are routine extensions of previous reports and that do not appreciably advance fundamental understanding or the knowledge in that area. Incremental and fragmentary reports of research results, verbose, poorly organized papers cluttered with unnecessary or poor quality illustrations. Violations in the ethical guidelines, including plagiarism of any degree or any type. The characteristics of good scientific research include an objective. It should be simple and clear. It has to be a serious discussion, intellectual and formal. How to write an effective research paper. We have to get ready with the data. We have to make a first draft and structure of a scientific paper and selecting the journal and submitting to the journal, and after submission you get for the revision and the gallop proofs. Various types of manuscripts are there in many of the journals, either full article or original articles, letters, rapid communications and short communications. Review papers and perspectives are also evidence-based reviews often guide the clinical decisions. Systematic reviews summarize the literature on a topic often invited. They are often invited. The research studies is the report of original data, either observational or experimental study. What are the key elements of an article? First, we should have a title that clearly describes the contents. The authors ensures recognition for the writer. Abstract should describe what was done. The keywords ensure that article is correctly identified in abstracting and indexing services. The introduction of an article should explain the problem and the methods explain how the data were collected. The results describe what was discovered and discusses the implications of the findings. And we should ensure that those who helped in the research are duly recognized. The references that ensures the previously published work is recognized. Appendices will put that provide supplemental data for the expert readers. The title of the article describes the paper's content clearly and precisely, including keywords. The title is the advertisement for the article. That's why you have to put a catchy title for your article. Do not use abbreviations or jargon. Search engines and indexing databases depend on the accuracy of the title, since they use the keywords to identify the relevant articles. Author listing. Only include those who have made intellectual contribution to the research, or those who will publicly defend the data and conclusions and who have approved the final version. Order of the names of the authors can vary from discipline to discipline. In some fields, the corresponding author comes first. Usually, the author who has written is the first author. The abstract is the mirror of full manuscript. It is a highly condensed version of the complete paper will become the abstract. The abstract can be structured, organized by headings, or it is unstructured as a single paragraph. Making of a manuscript. Usually it is done in a MRAD format. It contains the introduction, the methods, results, and the discussion. That is the standard format a manuscript is made. The introduction should include a concise review of the relevant literature. Provide the context and rationale why the study is needed and what is the problem being addressed. What is known already, what knowledge gaps exist, and how this will contribute for the extension of knowledge. This includes statement of purpose, usually at the end of the manuscript. Method section should be written as a receipt for the study's design so that others can reproduce the research. The study design, enrollment, the variables, measurements, data source collection, and ultimately the statistical analysis is the most important. For an article to get published, the proper statistical analysis is required. The results, we should not organize the results section by the order in which you did the work. Instead, make a narrative a logical progression. In the results, we read about the participants, the primary outcomes, tables, figures, and the complementary text. Discussion is the most difficult section to write as it requires the author to interpret. We should not overinterpret his or her results. Summarize the findings, the significance, what new knowledge is contributed, how does this compare with what has already been done. And we should always mention the limitations of your study. The future research direction should include at the end before concluding the paper. Conclusions, do not extend your conclusions beyond what is directly supported by the results, because we avoid undue speculation. The conclusion should be based only on the findings, observations, and results that you have found in the particular study. We should not include in the conclusions that was reported earlier by other studies. Regarding citations and references, whenever you draw upon previously published work, you must acknowledge the source. Any information not from your experiment or study and not common knowledge should be recognized by a citation. How references are presented varies considerably. Usually, the style of this Vancouver style we use. Avoid references that are difficult to find in your manuscript. Avoid listing related references so that they were not important to this study. The style and language of the journal, usually instructions to the author for the journal, they provide the style and they provide guidelines how to write a manuscript and the style of the language we use. Some authors write their paper with a specific journal in mind. When you make a manuscript, you must first think ahead to which journal we are going to submit this thing. So you should always aim at a journal that is with probably it would be accepted in the journal. Like suddenly the first paper itself, we should not aim at submitting into New England Journal of Medicine or Lancet. So you should go to a national journal, Indian journal, which is indexed. So that should be, you have to choose the appropriate journal where there is a probability, more probability of getting accepted in the journal. Nowadays, most of the journals will have online submission. Many publishers now offer a completely electronic submission process. Article is submitted online and all the review procedure also happens online. It speeds up the editorial process. The key elements in publishing a manuscript, we have to discuss about the ethical issues, the style and language, and the structure of the paper, the components of paper, the article submission, journal selection, and publish process. Publication ethics, the deliberate and systematic consideration of moral problems arising in connection with your publication of scientific research. What is scientific misconduct? Scientific misconduct means fabrication of data, falsification of data, or plagiarism, or other practices that seriously deviate from those that are commonly accepted within the scientific community. Why ethical issues are important? Ethical violations, especially less serious infractions, are very prevalent. The rates of detection are low. Ethical violations affect the quality and integrity of the research. Intellectual honesty in reporting the research is very important. We have to be honest in reporting your results. Accuracy in representing the contributions of other co-authors. Collegiality in scientific interactions, including communications or sharing of information. Transparency in conflict of interest or potential conflict of interest. Protection of human subjects in the conduct of research, and if it is an animal study we have to declare that human care of animals in the conduct of research. Adherence to mutual authorship responsibilities between the investigators and their research teams. Usually the author's priority of a journal depending on the impact factor of the journal, the reputation of the journal, and also the access to the target audience. If you publish in a journal, you should be available for the target audience, the overall editorial standard of the journal, and also the with speed the publication is coming to this. So the reader's priorities, they look at the authoritative quality of the articles, ease of access, rapid delivery, convenient format, linking of information, low or at no cost, up-to-date information. These are the priorities that reader will look at your manuscript. The authors are general focused and the readers are article focused. The journal process, prospective authors should not be disheartened if a manuscript is rejected or needs extensive rewriting. This is usually the rule rather than exception. And editor decides whether to send for review, the peer reviews assign, then the decision comes whether to accept or reject. And then once it is accepted, probably it requires revisions and resubmissions. So this is the overview of peer review process. When the paper is submitted, first they confirm that the paper is received and initial decision is made by the editor either to reject it straight away or if you decide to send it for review. Once they send it to review, there are so many steps that take and which is informed to you. So the notification of the author occurs early. Once it is revised, then the revisions then finally they will accept. This process will take from 2 to 3 months depending on the journal and sometimes even longer. And once the decision is there to revise the article, we have to respond for the reviews. It's a very important step in submission of an article. Reviews may sometimes appear very arbitrary, sometimes it looks unfair and poorly performed. However, it is a reviewer's job to be critical and there may be elements of truth in even the most negative reviews. Once given the reviewers given their opinion, we have to read the reviews carefully. We have to take a breath, consult your co-authors, and also prepare the response table because each and every point has to be responded in point-wise fashion. So only when you address all these problems only the next process for acceptance would be happening. If the paper contains some of these things, the immediate rejection happen. Those the subject matter is of insufficient interest to the readership, to a specific genre, lack of new information, the results are very trivial, predictable, and sometimes duplicative of other studies, insufficient interest, the scientific quality is very substandard due to pure experimental design or methodology. So improper conclusions also will result in immediate rejection. So what we have to do when you get a paper rejected, do not get discouraged. Read editorial comments and find ways to improve the scientific quality of the paper to make the study stronger and acceptable for publication. Do not just turn around and submit the paper to another journal. Rejected papers can be resubmitted if and only the concerns of the reviewers are adequately addressed and new results are included. Plagiarism is defined as using another source's ideas, words, drawings, data, figures, findings, or conclusions without reporting or by misreporting the original source. So plagiarism is a plagiarism, irrespective of the intent, whether innocent or sloppy. The amount, a single phrase or sentence is a plagiarism. The source and the copyright. These are the things we have to consider when plagiarism. So what are the responsibilities of the author in preparation and submission of the manuscript? Ensure the work is new and original. All others listed are aware of the submission and agree with the content and support submission. Agree with the manuscript can be examined by anonymous reviewers. Provide copies of related works submitted or published elsewhere. Obtain copyright permission if figures or tables need to be reproduced. In summary, one can make a successful publication when the research being reported should have been conducted in an ethical and responsible manner and should comply with all relevant legislation. Researchers should present their results clearly, honestly, and without fabrication, falsification, and inappropriate data manipulation. Researchers should strive to describe their methods clearly and unambiguously so that the findings can be confirmed by others. Research should adhere to publication requirement. The submitted work is original, it is not plagiarized, and has not been published elsewhere. This is a very important to submit this. The author should take collective responsibility for submitted and published work. The authorship of research publication should accurately reflect individuals' contribution to the work and its reporting. Funding source and relevant conflict of interest should be disclosed. There is no way to get experience except through experience. Scientific publication is a team effort. It is with the journal, the authors, and reviews. So, to publish your thesis, to make a good paper, it's a lot of effort is needed to publish a paper. And what are the slides we will be sharing with the interested people so that you can go and again go through the slides, so you will get information on that. And from the beginning itself, with the design of the study and the process of conducting the study, and finally making a manuscript is a tedious and also a serious process. To make a good publication, one has to be very focused to do the job. Thank you. Yeah.
Sir, because students keep suggesting topics for thesis all the time,
Yeah.
is already a type of work published. For example, let us say if we have the incidence of HOCM or
Yeah.
somewhat unusual spectrum, there is no data available for Indian patients. Does it count as an original study?
Yeah, because of the geographical variation, we can study how the hokum present in Indian population. So that will become a original only, because what the people have described a hokum, either from the US or from Germany, because the pattern of these hokum may be different from what we published in, because we have also septal thickness. Some of them will have only mid-septal thickness and apical hokum. So what is the incidence in the thing? So accordingly, we can report how these things are tackled also. That's a very important thing. So yeah, that's why we should have the data on Indian patients. That will become original.
Because a lot of our ethics committee people or even the hospital people, when we are collating data on patients referred for transplant, they say, what is the new thing in this, what is the new thing, but there is no data on how Indians present.
Yeah.
We are a totally different subset of population with for lung transplant or for heart transplant. uh, Within the spectrum also there is such a varied spectrum which we are getting. So when there is so much of paucity of Indian data, I don't know why even many journal reviewers or many even our own ethics committee people, somehow they are reluctant to say that just by saying if it's an Indian data, what is so new about it? They are just objecting. So maybe are we right
Yeah.
in projecting?
So, no, because there's probably even the ethics committees in India also should be informed by the people when we are doing, because they are different. So we are all human beings, but the geographical variation, the genetic background for these patients, how they present, there are so many modifications. So looking at even the coronary artery disease, what we get is totally different from what the Westerners are doing. Because whether they have done multi-arterial, whether it really works for Indians, whether multi-arterial, or for Indian coronaries, we need to do all arterial grafting only, because the incidence of diabetes is so high, and also the venous grafts fail very very prematurely in the diabetic patients. So actually, though it is a coronary artery disease by the disease entity itself, the Indian coronary arteries are different from the other thing, because we have to have a data on Indian patients. Otherwise, we cannot be there. Because say bilateral mammary usage. In the Westerns, they say these are the criteria: age under 65 years or whatever is, will give bilateral mammary, the lateral or there. In India, we get diffusely diseased coronary arteries, and the incidence of diabetes is high. Is it worth taking the risk of sternal wound infection in Indian diabetics and give bilateral mammary, or give only single mammary and the rest of the veins or the radial artery for this thing? Unless, because we are hypothesizing that would be same as this thing, but we have to prove the hypotheses that are the same. So by doing this, it is not the duplication of the study, or it doesn't add to the existing knowledge, because there was no reports how our Indian patients behave for the surgical intervention. So that's why we have to develop our own data, because that's the only way. Otherwise, even in the United States, when they publish different article, they are all published in one area, another area, so like that in each state. So lot of publications are coming on the same thing only. But only thing is the geographical variation from the where it has come. So we would be looking how this disease pattern behaves in this part of the world. I think we also should write to the ethics committees also in approving or this thing, that there is no data, much data available. So our people will behave differently, because there are a lot of genetic variations. Even the mammary artery sizes are smaller compared to this thing. So the endothelial dysfunction is much more common than the Westerners. So our grafting strategy also should be different from that, which is suitable. So without evidence, we cannot adopt any new thing. So for that, we have to generate evidence. And that's very important, because unless we publish our data, those people also would not, in the coronaries can be like that. We do endarterectomy, still you put an arterial graft or vein graft, because they have not encountered so many times the endarterectomy as we do. So our ethics committees also we should probably instruct for all the ethics committee. So these are the things we can even take up at the ICMR level where they control all the ethics committee in India. We should also write to them that if the student thesis is coming and ethics committee clearance is there, probably they should instruct the ethics committee any study done on it with the same similar study in the other parts of the world should be acceptable to India because we want data on Indian patients.
And sir, by nature, it is a bit difficult to conduct randomized trials on surgical patients. So, how to get around it? Or should we just present descriptive data?
Yeah, because doing randomized controlled trial in surgery, for that matter, is very difficult. Because that's the reason why if you take in the history, there's hardly any randomized study in surgeries. So there are a lot of difficulties involved in because getting consent for the randomized study is difficult because if you say patient, we give one mammary or two mammaries. If you say, and you have to convince the patient, so far evidence is equivocal. Unless we demonstrate equipoise before starting the study, we cannot do this thing. So the main problem is in our country, if you say any study, straight away people will say, we don't want to be part of the study because they think there is an experiment. That is one of the difficult things we get it. And it is not ethical to do a study without informing the patient. So that's why even ICMR also will be looking at because how far we have to inform. Only we can tell both the procedures are accepted and routinely being done. So in our case, we'll see whatever we get. First, we have to convince them both procedures are good. Otherwise, it is also unethical if you doing a study, already evidence exists. Like putting now we cannot do a study either vein or mammary good for LED. So that is unethical because we are denying whatever the patients getting the SVG fragment, that is ethically unacceptable. So any study we do, first we have to establish equipoise that both the procedures, as of now, there is no evidence to show that this study is better than the other.
Thank you, sir.
Because listening to this topic would be very boring also. Luckily, probably, I don't know, we do not have the lunch this time, so you are keeping awake. But these slides probably will be shared by these people so that they will go and read it again. Some information is there. There are so many things that are trivial, but we have to follow all those things to get a manuscript accepted for any journal. So it's very important to go to the same thing. And we have to listen to, we have to go through the instructions to the author of particular journal. Ultimately, those instructions are binding by that journal for your manuscript. This is only just a guidelines how it has to be done. Because unless you have this research work, whatever stage of your career, will definitely help you. Not only because doing surgery is one thing, to make you popular or to make you a researcher will help to improve your practice also. That's important, knowing the techniques and also doing some research and getting some knowledge, because we should be deciding which procedure is good for which patient, individualize the treatment. Unless the data is there, we cannot individualize which treatment you would give. Thank you.
Thank you so much, sir. Thank you very much.